That's what we gotta be to be deep sexy. Deep Hi, we're the Diva Docs, Elisa Smith, MBA doctoral candidate, Dr. Tina Scott, and our new member of the Diva Docs, and that is representing Diva Docs UK. We're going global, people. And that is Dr. Emma Cook. And today we are talking about breast cancer. Dr. Emma, this is her story. So Dr. Emma, with regards to diagnosis, how did that come about? Was there family history before then? And how did that impact you?
My grandma had breast cancer, so there was a family history. She had it when she was very young and had a mastectomy, which was how they dealt with it in those days. But it came back, obviously, age-related. Because of the family history, I went to genetic counselling. So in my mammogram, they found some tumours, and I had choices to make at that point because I had options. So I consulted with my surgeon, and that's how this story comes.
Wow! And Dr. Tina, you're a psychotherapist, and you deal with the gamut of patients. What things do you see in patients, or what emotions do you see in patients when they're diagnosed with a condition such as breast cancer? What do you see?
Well, it's definitely a high level of fear. And not only from the psychological aspect that I have experienced, I actually was one that actually performed the mammograms on patients when they were diagnosed with cancer, when they were trying to see if it was malignant or benign. And just the lack of not knowing what's going on heightened their level of fear. The way the message was delivered, that you had cancer, it was just pretty much cold. It was over the phone until different regulations required that there was a different protocol that was followed. But there's a high panic, high level of anxiety. The moment that a patient is called to come back, there's a high level of concern, and there's a lack of response from the staff because the client or the patient doesn't know what's going on. It could be that they had deodorant on underneath their arms, and it may have just smeared the image a little bit, but this person is actually sitting home waiting probably for 30 days to come back in to find out if everything's okay or not. So it's a high level of fear.
And like you said, the staff actually don't have much care in the way they deal with it. Because I had a conversation with one of the secretaries, and her exact terminology to me was, it's only been a month.
Because you're worrying, you're not eating, you're not doing the activities that you normally would do, you're in a high level of depression.
I kind of did the opposite. I ended up doing more fitness and looking more at my food because I knew that would help me get through the op, which was imminent. So whatever operation I decided to take, I knew that if I had a higher level of cardiac fitness, it would get me through that better. I think I'm an unusual case. It's not standard, really. But it definitely made a difference.
But your knowledge of what to do is much more greater than most people because they have no clue.
Exactly. And your profession, you know all about nutrition. Dr. Emma, for any of you who want to know, has a site called Medicinal Kitchen. And so she knows all about what to put in her body.
Fortunately.
Yes.
It was quite useful. It was quite useful to have that.
Even if people survive, they're often psychologically damaged through what they go through in the aftermath with breast implants. I know I've had different friends where they've been diagnosed and bang, they're in for surgery, and then they have to wait before they can have the skin expanders to put the implants in. And I've had friends who've gone through 3 or 4 botched surgeries, and they feel like Frankenstein. That's what they've said to me. Their whole femininity has been taken away. And it's just
and the scars are permanent reminders as well of what you've been through.
So what was and I know you were able to prepare because of not only your medical knowledge, but you prepared for a couple of months in advance and had the skin expanders. What exactly happened?
When I talked to my surgeon, I mentally prepared myself for the diagnosis being positive, and I mentally prepared myself for having to have an operation, but I didn't prepare myself for the question what size do you want to be?
Right.
Because in my head, all I was bothered about was getting the tissue out and getting the tumours out. So that was something I didn't consider. When he gave me my options of what I could have done, obviously he selected the best one for my job and my lifestyle. So he was a very good surgeon. But I kind of had this image in my head that I would have implants put in that then would be expanded at a later date. So I was trying to prepare myself for waking up with no breasts. Because in my head, my understanding was that they would then inflate them with saline later on. Not exactly. I did have some shape because they put some saline in at the time, but I didn't expect that. So I actually came around from the surgery and I actually thought they hadn't done it. because you know when you kind of go, oh my god, I've still got boobs. Wow. And I thought, oh, they've not done it. Why haven't they done it? So I had a panic about that. But yeah, so then I had a course of 2 or 3 different expansions. But I think the aftermath for me hit after my last operation in September, because that was where I was. I wasn't going to get any better. There was no change going to happen from there. That was my lot. And I think the sex side of it, you know, women may have lost their nipples with this.
Exactly.
So it is a big deal.
Oh,
and there's nothing. Definitely. They just leave you on your own with that.
And the lack of literature out there, the lack of information out there for patients. Tina, what have you experienced with your patients with regards to the psychological impact of breast implants, and you know, either great implants or botched implants?
Well, you know, it's a difference when we choose to get implants, because you have so many people that for cosmetic reason they just want to enhance themselves or take them away. But when you're forced to actually have that type of procedure, it makes you feel like you're not sexy. When it comes to intimacy, it's like, I really don't want to take my shirt off, turn the lights off, mainly because you don't want the scars to be seen by someone else. So it's very emotional.
And they don't feel normal. You know, there's definitely, they're not normal. And you know constantly that they're not normal.
And you know, it's kind of like patients want to get your opinion, like, do they look natural? So as crazy as it sounds, they're like, so what do you think?
Okay.
Well, because they're seeking approval. Like, do these look right before I actually share these with my mate? Because for me, they don't feel the same. They really don't look the same. My nipples may be going this way, or so many different things, so they feel inadequate. And with society, the way it is today, puts a lot of pressure on different body parts and how they're enhanced and how it makes you look when you're outside.
And there is an expectation for everybody to be perfect. And you know, even if they look normal to somebody else, you know they're not. So you know you're not in that realm of perfection that we're all seeking.
Exactly.
So it is a very difficult situation.
After you'd gone through everything, you actually did a photo shoot in England, and you were there were a lot of people that were very angry. So what happened to that? What happened?
Well, I decided to do a couple of photo shoots to try and present a positive image for women who'd been through this. So I did one that was quite feminine, and I did one that was sporty and sort of fitness related in the gym. And for the most part, people were very positive. But I actually had quite a few people making very negative comments about them, and you know, I was doing it for the attention, and obviously I just felt like, you know, for me it was an awful situation, and I was warned it might happen because I did it through the Cancer Research UK. But I actually got people wishing me to die. People actually sent me private messages. They took their time out of their day to send me messages saying, "I hope you die," and quite a few expletives.
That's just crazy.
As an individual too, not allowing society to dictate how you feel about yourself. Unfortunately, many are experiencing cancer, and it's definitely making alterations to your body. But I think we have to be stronger within versus allowing the things from the outside to dictate how we feel about ourselves. So I think that's the start, and I definitely think counseling is very necessary, because without that, you'll find yourself spiraling out of control, being highly depressed, and the list can go on. So I think a great support system also.
Learning to love yourself.
Regardless.
If you are faced with a diagnosis, don't think it's the worst thing in the world. Prepare and get all the information you can. Seek information. Go to people who've had it done. Don't hide, and don't stay away from people. Reach out to people who've dealt with it. Reach out to people who've had hard things happen, because they will tell you the way around it. So just want to say thank you all, and hey, we're the Diva Docs. Check us out, www.divadocs.org, at diva_docs.
That's what